Welcome back to Daytime. Well, January is Alzheimer's Awareness Month, and we have on to tell us all about it Loretta Tanner. You are the Director of Public Education for the Alzheimer's Society of Durham Region.
Yes.
Now, the one thing that I really want to hone in on is, because of your position, educating the people out there.
Yes.
You know, we all think that being a little bit forgetful, things like that, that's typical of old age, but it's not. This is a disease. So please tell us a little bit about it.
Well, I think there's a certain amount of normal forgetfulness, but the kind of memory problems and functional changes and even personality and mood changes that happen with dementia are more serious, and people are tending to sort of see them as not serious and sit on them and delay getting a diagnosis and delay getting treatment. So it is important to get the word out there.
Mm-hmm. And what can be done to help somebody who does have, Alzheimer's or early? I know there's lots of different things, but
yeah, well, and certainly we've still got a ways to go, but there are some treatments. There certainly a diagnosis can perhaps have findings that certain medical problems that could be causing the symptoms can be treated and improved. There are some treatments for Alzheimer's disease and other dementias that help with the symptoms and can help people function better, think more clearly, express themselves better, and it doesn't stop the disease progress, but it can give them a better quality of life for a few years. And it's also important to think about lifestyle modification, support, education, understanding what's causing the changes in myself, or if it's a family member, just helping the family understand and modify how they deal with the person.
Mm-hmm. You mentioned something there, the family. It's so important to realize that when people are coping with the disease, it really does affect everyone around them. And especially with something like Alzheimer's, it really does, penetrate to the core of the family unit. And there certainly are a lot of services out there to provide support for those family members, isn't there?
Yeah. Yeah, right from the very beginning, we hope that people with awareness of symptoms are getting to their family doctor, getting through that diagnostic process, which can take some time. So that's the beginning, because often people do delay that start. Access to the Alzheimer's Society can be a good way of getting information about the disease process, coping with it, living well with the disease, kind of seeing it a little differently, and as well as then starting to perhaps navigate the support system out there, helping the caregivers manage, but also looking for supports, adult day programs, respite opportunities for family, and as time goes on and people need more support, they might need in-home or perhaps looking at some residential options.
There's some interesting surveys that have come out recently. You were telling me a little bit about, can you speak to that for our audience?
Well, yeah, the recent survey that's gone along with Awareness Month this year was just looking at almost 1,000 caregivers and kind of getting them to think back about their experience, and a good number of them did sit on the symptoms. I think almost at least half sat on those symptoms for a good year, and many for 2 years before they went to the doctor. And in retrospect, almost all of them regretted that and really saw that there could have been benefits of early diagnosis, not only access to the medications, but also thinking about the future, putting legal and financial matters in hand, thinking about decisions that maybe the person can make at this point in time for the future, as well as accessing those coping mechanisms and supports that we talked about.
It's important for us to know how to cope with it once we have it, but of course prevention is the key. Is there anything that we can do to sort of stimulate our brains? And I know obviously genetics play a factor, but
and while we can't say that we can prevent it, we can say that we can reduce risk factors, because most often these diseases are multiple risk factors, and so many of the risk factors are things like the things that you're talking about today: healthy eating, lifestyle factors. Exercise is a big one. Keeping active and engaged in life. One that we're hearing a lot about these days is protecting the head from head injury, and those are things that start early and throughout life, as well as access to socialization. That's important, and again, keeping the brain active.
Now, I know you have some important events coming up, so we want to mention those. Tell us about what's happening.
Well, in honor of Awareness Month, first of all, I actually should mention that our CEO of the organization just climbed Mount Kilimanjaro.
Yes.
And he's just back with us. So
right,
he did
and
manage.
we do want to have him on because I want to hear all about that.
So again, to raise awareness, about Alzheimer's disease and the work of the Society. We do have our Walk for Memories coming up this Sunday. Sunday afternoon at the UOIT Athletic Center. So it's a great venue, a great opportunity for families to come together, have some fun, put themselves to the challenge and do the walk, and it really it feels good to be able to do something. And next week we're planning a public lecture, Thursday, February the 2nd, so we're inching our way a little bit into February.
There you go.
We're having an evening lecture in Ajax Public Library. Dr. Cairn, who's a geriatric psychiatrist, well known in the field, and he's talking about treatment, diagnosis, and research.
Amazing. Well, all the information will be available on our website of how you can get in touch with these events, so please go and check it out. And more Daytime coming up right after this. Thanks.